The simple act of breathing, often taken for granted, holds a universe of information about our well-being. Each inhalation and exhalation produces subtle sounds, a symphony of breath that speaks volumes about the health of our respiratory system. For medical professionals, these sounds are not mere background noise but rather crucial clues that can unlock the secrets of the lungs. Just as a conductor listens intently to each instrument in an orchestra, physicians use a stethoscope to analyze the nuances of breath sounds, aiding in the diagnosis and monitoring of a wide range of respiratory conditions. Understanding the language of breath sounds is paramount in clinical practice. Normal breath sounds indicate healthy airflow and lung function, while abnormal sounds, also known as adventitious sounds, can signal anything from mild inflammation to serious underlying diseases. By recognizing and interpreting these sounds accurately, healthcare providers gain valuable insights into the state of a patient's respiratory health, enabling timely interventions and improved outcomes. Normal breath sounds are characterized by their distinct pitch, intensity, and duration, varying depending on the location of auscultation on the chest wall. These sounds, produced by the movement of air through the airways, provide a baseline for comparison when assessing for abnormalities. Vesicular breath sounds heard over most of the lung fields are soft and low-pitched, resembling the gentle rustling of leaves. They are typically heard throughout inspiration and fade away during expiration. Bronchial breath sounds heard over the trachea are louder and higher-pitched, with a hollow, tubular quality. These sounds are equal in duration for inspiration and expiration. Bronchovesicular breath sounds heard over the large airways possess characteristics of both vesicular and bronchial sounds, with a moderate pitch and intensity. Unlike the harmonious rhythm of normal breath sounds, abnormal or adventitious sounds introduce discordant notes into the respiratory symphony, indicating underlying pathology. These sounds can be continuous, lasting for most of the respiratory cycle, or discontinuous, occurring as brief intermittent noises. Crackles, also known as rails, are discontinuous high-pitched sounds that resemble the crackling of cellophane. They are produced by the sudden opening of collapsed airways or the movement of secretions within the airways. Crackles can be further classified as fine, medium, or coarse, based on their pitch and duration. Wheezes, on the other hand, are continuous, high-pitched whistling sounds produced by airflow through narrowed airways. They are often associated with asthma, bronchiolitis, and chronic obstructive pulmonary disease, or COPD. Raunchy, continuous, low-pitched, rumbling sounds are caused by secretions or obstructions in the larger airways. They often clear with coughing. Stridor, a high-pitched, harsh sound heard on inspiration, is a medical emergency, indicating severe airway obstruction. Section 4, Diminished Breath Sounds, a Murky Diagnosis. While the presence of abnormal breath sounds often points to specific respiratory conditions, the absence of sound can be equally concerning, albeit more challenging to interpret. Diminished breath sounds refer to a decrease in the intensity or clarity of breath sounds, making them difficult to hear. While diminished breath sounds can be a sign of serious conditions such as pleural effusion, pneumothorax, or obesity, they can also be misleading, influenced by factors like the patient's body habitus, chest wall thickness, or even the quality of the stethoscope used. Therefore, it is crucial to avoid relying solely on diminished breath sounds as a diagnostic criterion. Instead, healthcare providers should consider them in conjunction with other clinical findings, such as vital signs, medical history, and imaging studies, to arrive at an accurate diagnosis. Section 5. The indispensable stethoscope, a physician's ally. In the realm of medicine, where technology is rapidly advancing, the stethoscope, a humble yet powerful tool, remains an indispensable ally for healthcare professionals. Auscultation, the art of listening to the internal sounds of the body, allows physicians to delve into the depths of the respiratory system, uncovering subtle clues that might otherwise go unnoticed. By mastering the techniques of auscultation and developing a keen ear for the nuances of breath sounds, medical practitioners can significantly enhance their diagnostic acumen. The ability to distinguish between normal and abnormal sounds, coupled with a comprehensive understanding of their clinical significance, empowers physicians to make informed decisions regarding patient care. Furthermore, accurate and descriptive documentation of breath sounds in medical records is paramount, ensuring continuity of care and facilitating communication among healthcare providers. By embracing the power of the stethoscope and honing their auscultation skills, physicians can continue to unlock the secrets of the respiratory system, paving the way for improved patient outcomes.